Hello everyone, how you doing? Darren here, the COPD guy. Hope you're having a great day. Today I'm going to start the training series on COPD A to Z. So we're going to get started in kind of today's video. We're going to talk about what COPD actually stands for. So the C stands for chronic. Chronic means that this has been going on for a long time. It's not something that just happened overnight, or it's not something that just came on. It means that it's been gradually working on its way. Your body has been compensating for it along the way. And what I mean by that is, as you were getting a little bit sicker, your pH was changing up or down, trying to keep your pH in the 7.35 to 7.45 range. That's the normal range for your blood pH. So by chronic means your breathing was getting worse, your body was compensating for it, so now your normals might be 7.55 to 7.6. instead of 7.35 to 7.4. Do you see what I'm saying there? So that's what chronic means. It's happened over time. You've probably had symptoms and forgot about it, but you know it was festering in there. Next thing is obstructive. Obstructive means there's an obstruction of airflow from the lungs. An obstruction of airflow from the lungs. So that could be because you have a mucus buildup in the lungs. That could be because you have very enlarged air sacs or alveoli in the lungs. It could be because the membrane, the walls themselves are stiff and do have no elasticity. So there's several things that cause that, but obstructive means there's an obstruction from allowing airflow from the lungs. Pulmonary. It's the pulmonary system, meaning we're talking about lungs. That's part of the cardiopulmonary system, which is the heart and lungs work very close together. That's why a lot of times when you get sick from a pulmonary standpoint, you get pains in your chest because it's affecting some things going on with your heart probably as well. And then the final one is disease. And this is a disease. COPD is a disease. There is no cure for this disease, but what we're going to hopefully teach you in this course and throughout these video series is how you can manage your chronic obstructive pulmonary disease. I want you to understand COPD. Chronic obstructive pulmonary disease is a chronic inflammatory lung disease that causes obstructive airflow from the lungs. The key symptoms include breathing difficulty, cough, mucus production, and wheezing. It's a combination of chronic bronchitis and emphysema. And in the next video, we're going to talk about those in more detail. If you like this content, please make sure you hit like and subscribe. And I'll get you on the next video where we're going to talk about chronic bronchitis versus emphysema. Thanks and have a great day.